My name's Kiera Liblik. My pronouns are she, her, and I'm currently a medical student in second year and first year master's student at Queen's University.
What role do you play in global efforts to address NTDs?
Yeah, so a bit of background first. The role I play mostly is as a member of the Emerging Leaders Group of the Inter-American Society of Cardiology, which is a group spanning from the undergraduate level to young cardiologists aimed at providing connections with leaders in cardiology globally. One of our current projects being conducted by our group, which I'm fairly heavily involved in, is the Neglected Tropical Diseases and Other Infectious Diseases Affecting the Heart Project, or for short, NET-HEART Project, a little bit easier. And our work really entails looking at the literature around neglected tropical disease and cardiovascular implications. So it really began as a collection of systematic reviews developed in response to a paucity of literature addressing those cardiovascular implications of NTDs. And as you know, cardiovascular disease is the leading cause of mortality worldwide, but over 80% of those cases occur in low to middle income countries, and nearly 40% of those are labeled as premature deaths, and this is all according to the Global Burden of Disease study. So we can't fully explain the increase in cardiovascular disease in those places with population density or traditional risk factors, but we do know that these regions are severely disproportionately impacted by neglected tropical disease, and associated morbidity and mortality in these locations is high and likely even underestimated due to limited health data collection in some of the more remote regions. And considering the inequities in access to healthcare related resources that do exist in many regions severely impacted by neglected tropical disease, the usual recommendations for addressing cardiovascular implications may not be accessible. So the aim of our initial collection of reviews, over 10 of which are published now, inspired the meat of our project, which is the NET-HEART book, which summarizes the literature on cardiovascular involvement of a range of viral, bacterial, parasitic diseases, as well as snakebite envenomation. So the chapters look at epidemiology, pathophysiology, symptoms, diagnosis, treatment. And then really we wanted to recognize the possibility of limited access to resources such as advanced cardiovascular imaging and expensive interventions. So I guess in summary, my role is to be part of this NET-HEART project. And the purpose of it is twofold. It is to create a resource summarizing literature on often deadly cardiovascular implications of neglected tropical diseases, as well as to highlight the need for prioritizing neglected tropical diseases in healthcare policy, as well as data collection to better understand complications for those affected.
So what progress are you most proud of from this work, and what next steps are you prioritizing?
So the part of the project I would say I'm most proud of is really how we've gone from this set of systematic reviews to everyone's real excitement about writing this textbook and the textbook chapters, and now seeing it come together in a meaningful way. And it's truly become larger than the sum of its individual parts. Even now, the pre-order just went up for the book, and seeing it actually be real was so exciting. It's also created this international network of young future cardiologists who are excited about global outreach, excited about global health, and the impacts of social determinants of health on disease. And I genuinely think that each of these individuals will become leaders in the global effort on eradicating neglected tropical disease. In terms of next steps, I think that we are going to prioritize making the information that we have now be put together in a really easy to access and accessible way. So that is to have it available in different languages and to have it available in different formats. So for example, we've been talking about creating an app with a concise, user-friendly summary of each disease and how to identify and approach cardiovascular implications. And a real priority in pursuing this has been consulting a really broad range of experts involved in our project to make sure the research we contribute to this field is helpful, it's well-informed, and as I said, is accessible. So for example, we have Dr. Ivan Mendoza on our team, who's actually an expert in tropical cardiology, which is really neat. And then finally, just really doing things like this interview to increase awareness of this project, let people know why we're all so excited about it, and how they can leverage their platform as future healthcare leaders to support those impacted by these devastating diseases while lobbying for international and local intervention.
So why is it important for Canada to be involved in combating NTDs? I think some of these things can seem really far away from Canada.
I think that's exactly it. There's this misconception that because neglected tropical diseases are called just that they're neglected and tropical, they only impact this small set of individuals in a very far away remote region of the world, when in reality, they actually impact over 1.7 billion individuals annually. It's really easy to say this is not a Canadian problem. We need to focus our resources on local issues. But I would argue that with immigration and travel increasing, as well as what I'm sure we'll see is a post-COVID travel surge, that this is going to become more and more of a Canadian problem. And honestly, as Canadians, we should really care about these diseases that impact almost 2 billion people annually either way. We're part of this broader global community. And the importance of this has really been underscored during COVID, how quickly disease spreads, how devastating it is when it's in your own backyard, and how we've relied on global collaboration to protect the health of our own communities. So I think it comes down to the fact that these diseases are preventable, they're treatable, and it's unfortunate they continue to be so pervasive and destructive when we could really be playing more of a role as Canadians.
So to kind of shift gears, how did you get involved in NTD work?
So my initial involvement in the NetHER project was through Dr. Adrian Baranchuk here, who's a cardiologist at Queen's and as a co-editor of the book with Dr. Clara Saldriaga. He knew I was very interested in the intersection between cardiology and social determinants of health, and then brought me on for one of the initial reviews. I was really struck by the lack of information previously published in this area, and inspired by a lot of my colleagues in the Emerging Leaders group. So I started with a review on snakebite envenomation and cardiovascular implications. And as I got more and more engaged in the project, I ultimately became actually the co-coordinator of the textbook with Dr. Juan Farina, and was really in charge of coordinating the different chapters, which students were involved, which cardiologists were involved. And this has, again, underscored that importance of having global perspectives on the team, individuals from all levels of training, and this real bi-directional relationship between the younger learners in the project and some of the more established physicians. That I really felt heard. I felt like I received a lot of mentorship, and I grew a lot as a mentor to younger students throughout this project. And I feel immensely privileged to have been part of this project as a whole, and look forward to continuing to advocate for neglected tropical disease research.
You are the first student that I've included in this blog series, which is awesome. But it'll be really interesting to hear from you on how you think students and young professionals can get involved in these things.
So in terms of involvement, I think that my biggest advice would be to find someone who is working in that area, and honestly just send them an email. This area is truly neglected, and I need of passionate young professionals to contribute to the body of research, as well as advocacy in efforts in eradicating neglected tropical disease. I also encourage everyone who's interested to take a look at the World Health Organization new roadmap to prevent, control, eliminate, and eradicate neglected tropical diseases by 2030. It does a really wonderful job at summarizing the current efforts on neglected tropical diseases and how governments and individuals can get involved. And then in terms of how we can really mobilize governments, I think that research plays such an important role. Data speaks, and the data on neglected tropical diseases is really hard to argue with. And ultimately, the number one domestic policy issue is healthcare. And we've seen time and time again that the burden associated with neglecting prioritizing prevention and waiting until a lot of these types of health problems become epidemics is actually so much more costly to the government, and I think is a way for us to make it a priority for politicians. And a government is really meant to be a representation of its constituents and their interests. So the more we as Canadians and young individuals express that we care about an issue such as neglected tropical disease, lobby for its inclusion in political platforms, and leverage tools like social media to get the attention of politicians, the more likely it is that I think change will occur.